Thank you very much. After that mess up. First of all, thank you very much for everybody for coming and to attend my presentation. Those who have been seeing me in the past several AIOTA conferences, you will remember very well that all my lectures been in the area of teaching and learning. And then I presented in various topics. In a couple of sessions, I did, of course, on the subject of anatomy, which I've been teaching for the last 30 odd years. But I presented it in a different way of approaching several of these subjects in a different teaching learning methods. What I have done is, using the same anatomy subject, now at the post-pandemic, I use the blended learning approach, which is another new area of teaching and learning. So this is what I'm going to share with you today, using the same anatomy subject. And the title of my presentation, as you can see, is Applying Lessons Learned During the COVID-19 Pandemic to Teaching Anatomy for Occupational Therapy Students at a British University. And this is actually a joint presentation with my co-anatomy teacher, that is another one, Christopher Francis. As you know that the COVID-19 pandemic has disrupted face-to-face teaching in schools, colleges, universities, globally. We already know this, and this has affected us all the schools and colleges globally. Now, anatomy teaching has faced many challenges during the COVID-19 pandemic, and that is due to lack of reduced curriculum hours and also the lack of availability of CAD hours. This is actually the case in UK schools. I'm not very sure what happened in Indian schools during pandemic, COVID-19, whether you are also having the same problem about the CAD hour shortage. So that has brought us to a question that how we go about teaching anatomy when you have reduced curriculum hours and the shortage of CAD hours. So we come across, because of the lab closures, universities are closed, shut, everything, but the teaching must go on. So what we have done is a technology, self-regulated teaching method, that is a blended learning approach. So we use that during so online learning emerged as a sole option, continued during the lockdown and during the anti-social distance era. The integration of internet and information and communication technologies have enhanced student learning experiences in many university and the courses we did the same. Now, anatomy education is facing challenges, as I say, mainly due to reduced curriculum hours, I said, and lack of CAD hours. To overcome these constraints, there is a need to introduce technology-assisted, self-regulated learning methods such as blended learning, along with the face-to-face classroom teaching methods. Now, those who are teachers here or teaching the anatomy subject will very well know that how well we're going to use those, and particularly in teaching this. Now, I want to share what happened in University of Southampton. That is where I based. I've retired in 2010, but since then I've been going regularly as an academic visitor and teaching anatomy subject to the first year students. So I still continue to teach the subject there. So I want to share what exactly happened in the University of Southampton. Um, this was musculoskeletal anatomy and key part of foundation sciences teaching. So this subject is part of the foundation science teaching. It comes under the subject. Now, they teach along 2 semesters. One semester is made up of 14 weeks. So the total is a 28 weeks curriculum divided into 2 semesters. So what happens in semester 1? We normally do the general anatomy like anywhere, everybody does it, share learning. Then we have a seminars, but they are all OT specific. The OT specific anatomy applied subjects, that means all functional activities are applied using OT specific subjects. Linking musculoskeletal knowledge to functional anatomy as an OT practice, so we emphasize more on beginning from the year 1. And what happens in session 2? These are another 14 weeks. They go into the anatomy lab at the university. Of course, now during the lockdown period, that was the university lockdown, so what we normally do is that we only do the prosected specimens. And the cadaver prosections, plastinated specimens, and potted pathological specimens. So the students only come to the lab and look at all these specimens, and they go through over it in the second semester. The another online resource available to students during the semester 1 and semester 2. Now you all know that we have several instruction manuals now available online in anatomy. There are anatomy TV, there is a primal model subjects, there's several now. So therefore, shortage of cadavers may not be a problem, and using the internet-based self-instructed anatomy modules, they can actually go through and they can look at in the lab, the prosected specimens, just to particularly the gross anatomy, because no matter how much you look at the modules online, you don't feel exactly the feeling by touching. For example, if you want to teach to your first year students the difference between a nerve and thus they can see, and what is the artery. Now, although you're looking at the anatomy TV, they beautifully explains, lovely pictures, everything, but you don't get the same feeling on the internet by touching in the lab and feeling the difference between the nerve and the artery, because the internal structure is very different between artery and the nerve, and that you cannot teach online. They cannot feel that. So therefore, gross anatomy has a vital part to play for the year 1 students. So even though we show them in a prosected specimens and other labs, but we have that gross anatomy, we emphasize more for the first year students. Now, as you can see here, we have just shown you some of the models here, and this is everywhere, every lab we have the 3 anatomical model online. They can look at it with the clinical relevant notes. They also have anatomy notes and pathological slides. Also, we show them at the same time, and the practical anatomy resources they can see through the muscle groups and functioning. All these is available on the example TV content and all these. For example, I've just shown you one muscle here, how the description of abductor pollicis brevis. So they can clearly study the origin, insertion, nerve supply, and the action clearly, and they can make the muscle actually to act. Whether how does the hip abductor, this particular muscle plays a part, they can clearly see it. Then we come to the dilemma of the COVID-19 pandemic. Now, as you can see here, the university campus closed during the pandemic, and that lectures and seminars, all the tutorials, etc., they are all have to be done online. And then what we done is the university hospital, especially when we go there, and that we take our students there, and normally they spend some time in the labs and other things. The other thing is what we have now done is the brief review of the literature, that they will do the wide spectrum phenomena there. For example, I can give you the example here. They look at it, they divide them into the groups of the students, and they study self-study modules within the anatomy lab. So that's way how we reinforce the study of anatomy, even emphasizing more on the anatomy lab, and putting the surface anatomy and practicing each other, feeling these anatomical landmarks on each other's, and finding the origin, insertion, nerve supply of some of the actions. And then we give the case studies, and they apply those muscles all unto the given case studies. Now, I don't want to really go into the very much this blended learning, which I've already mentioned that blended learning approaches use multiple methods to deliver learning by combining face-to-face interactions with online activities. So some of them I've already shown you that we have a self modules available online, and that the students can take a look at it. On the right hand side, I can see that the blended learning approach, usually there are several online methods now available for using along with the traditional teaching method. No matter how much we use computer-based, the traditional face-to-face still plays a part. So in blended learning, it is a combination of both internet regulated plus as well as traditional face-to-face teaching. So during the lecture time, we give them a straightaway lectures in the classroom. Then when they come to the practical, they use on the computer manuals, computer lab, the self-instructed modules using in the lab, and then projected specimens, all these things. They still have face-to-face learning, very, very important in that. Of course, no matter what happens, we do have challenges and barriers during COVID-19 pandemic. And some of them are transitions to online learning. We had some problems there initially. There is a rapid transition to alternate pedagogical approaches. Not all the students appreciated this because of it was all of a sudden rapid change, and the students really all complained about the social interaction. What they used to have in a traditional teaching method in the classroom, they cannot have exactly the same. And the time workload and the labor, these implications for academics. That means we could not have enough demonstrators helping us in the anatomy lab, all those shortage of staff. Then the availability of learning technology during the pandemic, because the same resources what we used to have before the pandemic, we cannot have exactly the same. And the possibility of limited digital literacy, again, there's again shortage of some of these teaching methodology and everything, these methods. But they all played an important part in teaching the anatomy lab. Despite making all the difficulties, we have succeeded somehow, and the students were able to get through. What I did was just to compare what exactly happened internationally. It's not only the University of Southampton where I'm based, but I've just tried to look at it. And there are some of the very interesting findings, as you can see. For example, most of them are common. The one study in 220 that was done in USA, it was the International Qualitative Survey of Higher Education Learning. As you can see, what they found was the use of cadavers material was reduced. And that is I don't know the same here in India. I'm quite happy to hear if any of you what happens here. But cadavers have a big problem in the US too, also in UK too. There's an online computer-based sessions everywhere is increased. Same thing happened in the UK also. The digital online virtual learning resources everywhere be increased. And then, as you can see, bespoke in house create some of the most important things, as you can see here. I don't want to go through everything. As just glance through that, you can all see there are some commonalities between various studies, as you can see. Now, in India, Singh and others, as you can see, digital switch away from face-to-face teaching. That was happening in India, and you can see the same thing happens the other in South Africa, for example, and they also did the digital online virtual learning resources increased. So, compared to the other countries, some of the factors are very, very common during the pandemic. So some of them, if you pick up, is use of cadaver is gone down. Same thing in other studies. So the cadaver, because they're not available, the bodies. Distance learning approach used in some of the places. And as you can see, the synchronous online lectures, that means basically the programs, they run parallel in the other. And online computer-based assessments is increased. That means the students were asked to do more computer-related based assessments. That has gone up in South Africa. And UK also, as you can see, maintenance of cadaveric dissection, the blending learning approach, that what we used it. So India, USA, and if you can see again, another countries, Greece, for example, use of cadaver materials. Now everywhere, all the countries, no cadavers, because they may not be available or there is a shortage of cadavers. So everybody is all gone down. And what is increased? Digital, online, virtual learning method. Of course, that is the only method is available to teach. So this is all gone up. So distance learning is again used it. Australia is very interesting. If you can pick up few, what they did, weekly online seminars has gone up. Video of this dissection is gone up. As you can see, digital, online, virtual learning resources gone up like any other. Students making own 3D models. That's interesting. In Australia, the first year students were asked to do their own materials. Then, of course, very interesting, body painting to reinforce surface anatomy. Now, I taught this in Hong Kong, body painting. If you want to really take a look at it, the course and distribution of the brachial plexus. Now, the best is to teach brachial plexus is actually painting on the body. They can see these are all the trunks, cords, branches, and you can see bring down the median nerve gradually in a different color. You can bring the radial nerve, median nerve, and the ulnar nerve, and they can clearly see in the forearm how these three nerves are coming up, and they can see which nerve supplies which muscle. And that is a wonderful. You can see the body pains using, and one of the best example is the brachial plexus using. So, some key themes, what are emerging from this? You can see that the anatomy education, however, has never been delivered solely online or remotely to medicine for allied health programs in these countries. Now, usually what happened was remote learning cannot replace, this is a very important point. Remote learning cannot replace the traditional anatomy teaching method, but online lectures could be incorporated into anatomy curricula as an additional tool. I think I agree with that. This is a very, very important point. That's a very, very important theme. We found that the students who took the anatomy course during the onset of COVID had slightly higher overall average score. This is an interesting point. How the students were working very hard using the anatomy TV, anatomy models. They were spending more time in the anatomy labs looking at the models online. And they are preparing exams. And they scored more higher marks than what they were doing during the non-pandemic years. So that's an interesting point. The students, even with the online learning, students can do much, much better and much can perform. So, what this changed approach during pandemics? So, we have done, I think I've already gone through it. This is one case study, very interesting. Look at this, how we have most of the, in anatomy, as I say, it is a case-based approach. So, that is where the OT specific subjects comes in. So, students get the pure anatomy lectures in the anatomy lab, and they will have practical sessions or OT specific, and in that they do the case studies. And they have to bring in the anatomy when doing this case study. Now this will give you very interesting case study where how anatomy is applied here. Now this is a Ben, nervous system case study, is a spinal cord injury. So we give this to the first year students. And when they're doing the spinal anatomy, when they study, and they look at this case study. And in that, as you can now, they have to recall the anatomy of the spinal cord, and we have given some, they have to label just to see whether they know the spinal anatomy or not. So, they have to label them. So, these questions designed to prompt students in identifying key anatomical features relevant to the case study. Now we will give them examples afterwards, but first in the class they will divide into groups and they go away and work out this subject and label those diagram and what are those. Now they can see that first of all the spinal cord, they should be able to look at the vertebral arch. I don't know how many you can recognize? Anybody can recognize any of these? They can see one of the durameter, as you can see. You can see the spinal nerve, some of them. So as you can see the labels here now, check yourself. Spinal cord, the dorsal root ganglion there, and you can see the vertebral arch and the durameter and as you can see down the central canal. So the students have to recall the spinal anatomy. Now, there's a very interesting software now that has come up in anatomy that is called primal pictures. I'm sure some of you already did it, you must have seen it. It's an excellent resource material, and it has what we do is usually we PALMS application, that is the perceptual and adaptive learning methods provided by these particular pictures. Students have to spot the exam questions, identify the key and later on they practice it, and so I don't have time to go through that, how actually the students will get these questions right. So coming to the conclusions, so relating to detailed workbooks or pre-session revision for students facilitates engagement and the value of lab sessions. Now, the another important is the prepare systematic review to pool learning on positive after pandemic on anatomy teaching. Now, all those adaptive methods we used, perceptual or adaptive response, anything, whatever we do the case study, these. So ultimately, the students were able to, we get through the year one subjects very well. So these are some of the references. Thank you very much.
Thank you so much, sir, for your nice presentation. And I'm so sorry for the technical glitch. I spoke wrong introduction. I'm sorry. And I would like to request Dr. Anil Kumar Srivastava, sir, to felicitate Dr. Bhumi, sir.